Our next speaker is Stephen Mondernock, Executive Director of the Association of Food and Drug Officials. He'll be giving some opening remarks from AFDO. Hi, Steve.
Hi, Jacinda. Thank you very much for allowing us the opportunity to host this wonderful virtual seminar that we're doing right now. We want to begin by thanking our FDA leaders for all their work in organizing this year's seminar, in particular Tom Nerney and Jacinda Davis, and of course, Lori Farmer, their national leader. This year, we're trying something very different with a new method, with all of our regions participating together in a single seminar with regional breakout sessions during the event. Although we are sad that we can't get together in person as we would have traditionally done due to COVID, this meeting presents great opportunities for us all to hear the same information at the same time from the same presenters. That's a wonderful opportunity that we've heard from many programs was a desire across the country. We look forward to this experimental concept here in the National Retail Seminar we're hosting this week. As we start this seminar, I want you to all think very carefully. Retail food safety must improve if we are going to reduce foodborne illnesses. CDC data indicates that retail food locations are the single most common location for outbreaks, with over 75% of the outbreaks in retail origin. If the food safety system really wants to reduce foodborne illness, improving retail food safety is the single biggest way to make an impact. Retail food programs have received much attention during the past few years. Thanks greatly to the leadership of Deputy FDA Commissioner Frank Yanis, retail food safety is a critical element in FDA's blueprint for the new era of smarter food safety. Further, FDA has put its wallet where its mouth is, as Lori just mentioned, and provided a tremendous increase in funding for retail programs through the Retail Flexible Funding Model. With more funding, though, comes more responsibility. We all must show accomplishments for this funding and ultimately a reduction in illness. With these funds also comes an opportunity to reinvent retail food safety programs across the country. Or imagine, perhaps this is an opportunity to do a little bit of renovation or rejuvenation like you might do in your home. As a result of COVID, retail food programs have encountered many challenges and opportunities which have forced us to think outside the box. Longtime routine thinking and operations have evolved into new methods, concepts, cultures, and new operations. We've developed new ideas and strategies for food safety, streamlined the operations, and retooled our business plans. COVID-19 has required us all to change, whether you're a regulator or industry or consumer. Though it is no longer acceptable to say the way we have always done things is the way we're going to do it now. This gives us a great opportunity. COVID-19 has made us all look at how we can perform better with the fewest resources. As we continue through the pandemic and hopefully near recovery, we should all look back at the changes we have made and what was successful and consider what things we can keep for the future and can be retooled to better make us productive in the future. Deputy Commissioner Yanis is the world's champion and literally wrote the books on food safety culture. But what is food safety culture? Industry perhaps has a better understanding of food safety culture today than our regulatory community. COVID-19 has resulted in a tremendous change in food safety culture with hand washing. Food workers better understand the why hand washing is essential and recognize that it not only impacts others, but them and their families too. This culture change hopefully will be something that continues to have a tremendous impact on food safety culture post-COVID. Behavior changes often are thought of as a top-down approach. Management says we're going to do this and let's go implement it now. But what we often see is that's not the most effective way to make these type changes. It's really bottoms up often works better. During the pandemic, we've seen innovation developed at the lowest level, whether that be at the employees or the inspector level, looking to make changes and implement these new things that we have to do because of the change in our times. You might wonder, what does food safety culture really mean for you as a regulator? It's pretty simple to me. I think food safety culture is akin to a public health culture. Are we doing the things that we need to do to keep food safe for me and for my family? I will tell you the status quo is not good enough and it hasn't worked. We haven't seen a significant change in most retail-based illnesses in 20 years. We regulators must take a look at our inspections, what we are doing, and determine what's effective and what's not. Will or can an inspector recognize what they have identified for non-compliance and ongoing non-compliance in an establishment? Are our changes and inspections making a difference to the operation? Are they correcting them long-term? Are we finding the root cause analysis or the root cause for these risk factor violations? Jurisdictions and regulators must change their culture and their behavior to take extra steps with industry. This will result in establishments achieving permanent compliance. Regulators must make sure those ongoing non-compliance issues are discussed, followed up on, sometimes more than once, and they are verified for long-term correction. This ensures industry's behavior has changed, but also requires a change to regulatory programs. Our traditional methods of follow-up, often revisits, may not be the most effective ways to change behavior. Perhaps we need to use more risk factor control plans with a greater interaction with the individual establishment over time, and get more commitment from the establishment's management to correct those risk factor violations. Are we focused on the right things, the foodborne illness risk factors? Are we trying to meet an artificial non-public health-based frequency mandate? In other words, getting our widgets of inspections accomplished. This might mean we have to be in operations when they are doing challenging process, such as the cook, chill, and the reheating. Too often, I read an inspection report with an operation doing many complex things and not observed is marked in all of those complex areas. That is simply not good enough for our food safety culture and the regulatory community. We have to be there when the complex activities are taking place. That means we might need to inspect smarter and use our resources better. Are we inspecting the right operations? If we look at where we see illnesses, it's in catering operations, full service type food service establishments. Are we spending enough time in those places when they're doing those key critical activities? Are we also looking at the places where outbreaks have been attributed and focusing our time there? One good example of perhaps not the best use of resources is how many outbreaks have been attributed to the action of a dollar store type operation. Maybe we've spent too much time inspecting those type operations. For programs who have mandates for specific numbers of inspections each year, now is the time to propose some legislative or administrative changes as a new way to operate. Now you have the facts and the documentation to support you can work in different ways, and it's appropriate to ask for a change in the future. Over the years, food safety programs have been given tons of mandates, many of them non-food safety related. Now might also be a time to do something unusual in government, and that's eliminating some of those programs that are non-food safety related or non-public health related, or moving them perhaps to being complaint driven. Lastly, if we have a food safety or public health culture, we must do better with foodborne illness investigations. Often these outbreaks are just one more thing on a list of activities that must be completed by an inspector and isn't going against their widget number of inspections. Foodborne illness and outbreaks must become a priority and take on urgency in a food regulatory system with a food safety culture. Enhancing program procedures and plans that focus on the what, when, how, why, or really the root cause of an individual outbreak or foodborne illness in establishments. Beginning the conversations with industry early when there's signals. You may not have all the information, but talking early makes all the difference and may actually result in early mitigation strategies before you have enough evidence to take regulatory action. There's a wide variety of resources out there, and you all know those, and even more becoming available, but this is a great opportunity to rejuvenate your foodborne illness response program. Important questions also include determining, does it make sense to specialize outbreak investigations? Are there other things we can do to be more effective as we go? With that, I just want to thank you all for taking a few minutes to listen to me this afternoon or morning. And there are a few things to start thinking about as we go into the presentations for this retail seminar. I challenge all of you to look to the future on new ideas and processes that can move your program forward, make you more successful and effective. Develop the mindset that if you do things the way you have always done them, you will continue to get the same results. And the same results are simply not acceptable. We must do better as a public health system.
Thank you, Stephen, for your open remarks. I did see a few amens, Stephen, so thank you.